Obesity, fat shaming. It's difficult to say which of the two is the bigger problem in Trinidad and Tobago. Fat shaming is a form of bullying. Big belly, fat thing, mampy. Some believe that making overweight people feel ashamed of their eating habits may motivate them to lose weight. Some people also believe that Savannah Grass should have won the road march. In 2013, the Food and Agriculture Organization ranked Trinidad as the 5th fattest nation in the world. In 2014, according to the World Health Organization, Trinidad tied with Barbados as the 19th fattest nation. In 1999, the overweight or obese category among primary school children was approximately 11%. By 2009, the level was 1 in 4 children. These figures are linked to falling rates of breastfeeding, unhealthy eating patterns, sedentary lifestyles. Advertising and promotion are listed as the main factors that promote weight gain in Caribbean children. Caribbean women are 3 times more likely to be obese than men. Obesity is killing people. 60% of deaths are due to non-communicable diseases like diabetes and heart disease. Yet somehow Trinidadians are more terrified of Venezuelans. And Trevor says, so there's fat shaming and there's the fat acceptance movement. Fat shaming is dangerous. Bullying crushes confidence and isolates people. Ask Iowa George. Discrimination isn't a motivator. No one should be criticized for their weight, food choices, or sexual orientation. No one. Except Catholic priests. It's weird, but encouraging overweight people to focus on losing their excess weight has been linked to an increase in overeating.
I eat because I'm unhappy. I'm unhappy because I eat.
Then there's the fat acceptance movement. It's a social movement which aims to eliminate and raise awareness of discrimination towards obesity. Think fat empowerment, fat activism. On the other hand, some argue that the fat acceptance movement aims to normalize obesity and is hazardous to our health. Maybe that's where Dr. Fuad Khan fits in. Back in 2016, he said that the US culture of fat acceptance and no fat shaming is going to negatively impact Trinidad and Tobago. People are going to say, if you could do it in the US, then we could do it here. People will think it's okay to be obese, but it brings with it a number of serious complications. He goes on to say that fat acceptance puts a damper on the war against obesity. Women and children are getting too fat. At one time we had nice women in Carnival. Now nobody wants to look at our Carnival again because it's only obese women walking all over the place. Dr. Khan, I'm really disappointed in you. I mean, how could you forget fat men? In 2019 on Ash Wednesday, using social media, a woman shared her experience during Carnival as a masquerader. The post says, truth be told, we in Trinidad are a body shaming society. Some do it consciously and directly, while others may not even understand that they are doing it. She produces 4 hurtful episodes as evidence. Dr. Khan responded, and somehow he managed to add a 5th episode to this woman's story. He calls the lady a tub. He tells her to shut up. Can you imagine Fuad Khan sitting at home watching Carnival on television, rubbing his belly, shouting, "Shut up, you fat tub! Kamala, bring the punch in there." You should probably drink a light beer though. Horse, you're a doctor, you're a public figure. Why the harsh words? Is it that you're so passionate about fighting the fat that you said stupid things? Regardless, people are outraged. Even Singing Sandra took a turn in Dr. Khan's steel, calling him names. Just so you know, Singing Sandra, you offended a large portion of the animal kingdom when you compared Dr. Khan to a patong and a jackass. As citizens, it's easy to say that the cards are stacked against us, that it's impossible to lose weight. We have long days at school and work, we spend hours on the road, stress, inadequate, unsafe or expensive facilities. The cost of fruits and vegetables, an apple is $5, a lemon is what, $5? One grape is $5? And a doubles is $5?
Lemon doubles. Lemon doubles.
So let me get one with slide. Perhaps instead of standing divided on this issue, we should be coming together and creating environments that support a healthy lifestyle. The Caribbean Public Health Agency, a CARICOM organization, has outlined a plan for promoting healthy weights, nutritional standards, reduction and marketing of unhealthy foods, on-the-job training, I mean that literally, yeah? Increased activity, put down the video games and tablets, go outside and run or walk or play mass. Calorie labeling on food menus. This I'd love to see at restaurants. Is it just me, or have you ever wondered how much calories are in a doubles or a box of KFC or sweet and sour dog? I love fries. Some KFC. Big belly, bring something for me to drink now. I do really think that. Red Wall News. It's better than blues.